Seeing no other members of the subcommittee, it would now be my great honor to recognize a member of the full committee, Dr. Schrader from Oregon. 5 minutes for questions. You may have to move to a microphone that's actually working. I promise I didn't turn yours off. And thank you for being here, Doctor.
Thank you very much, Mr. Chairman, and Ms. Goss, I appreciate you being here. Difficult position, FTC trying to talk about health, safety, and price competition at the same time. I guess make a comment here. I mean, in your own report, you acknowledge that there is increased competition in the veterinary prescription marketplace. Prices are going down already. PetMed Express claims to have 2.5 million customers, 50% of the business being prescription meds. I guess I'd ask, where's the problem here? Where's the problem here?
We think that consumers benefit whenever they have additional information that enables them to exercise their choices in the marketplace. And based on the record that we developed as part of this workshop, although our understanding is that many consumers have a very close and trusting relationship with their veterinarians and they're already having these discussions about prescription portability, we think there's room for improvement.
Well, there's probably always room for improvement in anything. I think it gets a point of diminishing returns. And also, to be honest with you, the tone a little bit is impugning my profession. I've been a veterinarian for 35 years, and I could have made a lot more money in a lot of other professions. I went to school for an exhaustive period of time, in my opinion, and I chose veterinary medicine because I love working with animals. The prescription piece is a small part of what we do, and I think some of the testimony, with all due respect, that you have is outdated. You know, 20% of the business being prescriptions, I'll wager you in this day and age, it's actually much less. My own practice over time, back in the dark ages when I started, yeah, medications were a big part because there weren't a lot of opportunities elsewhere. That has changed. I think it's changed for the better for, frankly, a lot of the folks out there, whether they're the client or the actual pet itself. And the trend in veterinary medicine, just so you're aware, and my colleagues, is to pay for services, not for items dispensed. It's much like what we're seeing in human medicine. It's a value-added type of reimbursement system. Veterinarians have voluntarily, in recent years, last I'd say 6, 8, 10 years, reduced the number of vaccines they give because good research has shown they don't need to be doing that. And I think that's a tribute to the profession. It's not about making money. It's about providing the best health care to the pet. Now, I appreciate the FTC comes at it from a different standpoint. You know, your background is in competition and getting the best price, best opportunity for the consumer, and that's fair. But that's not what veterinary medicine is all about. We're about protecting the health and safety of these animals. To be honest, as Ms. Brooks pointed out, these so-called complaints, you can't verify where they've come from, who they've come from. My guess is they come from, frankly, the pet med type of distributors out there, where their one single motivation is to make money. You know, I respect that. This is America. It's a market system. But they do not have the best interest of the pet at all in their sights. And the biggest thing that I would recommend the FTC also look at as they go on with this, if they're going to go on with this, is to look at, what's the implication of allowing these big national distribution chains to issue prescription medications ad libitum. In other words, what we find in the veterinary field is you'll have a prescription that says 30 days worth of thyroid medication for your animal, and pet meds will come back and give them 120 days. How does that give the veterinarian the chance to make sure that that client does not go beyond what is safe for that pet, to make sure that pet's getting the needed check, to make sure that medication is actually working correctly for them? There's a huge disconnect between where I think you're going with regard to how the veterinarians act and the real culprit, the real worry, is how these prescription distribution business companies are. It's purely to take advantage of a marketplace. And I'm all in favor of free market enterprise. I always encourage, I think most veterinarians, to get the best deal. They come to us initially. You give them an initial prescription if it's a chronic medication. Consumers are very sophisticated these days. There may be a few that don't understand. They can go online or, get medications elsewhere. But I think in this day and age, most of them are very sophisticated. I have clients come in and say, hey, doc, can I get my Rimadyl or my HeartGuard from somebody else? I say, sure, because I'm not making much money on it. I'm probably losing money on it. You mark it up a tiny bit because of the competition that's out there. That's good. But it's there in case my clients need it in a crunch. They know I'm going to be there for them. Pet meds may take, 24, 36 hours to get them their needed medication. So I would just add the health and safety thing in there. I think that's something that's being totally missed in the discussion at this point in time. The other issue I'd bring up real quick, and hopefully would be commented on the second panel, is the idea that somehow the distribution system is limiting generics for veterinary patients or veterinary clients. Nothing could be further from the truth. I get calls all the time as a veterinarian, member of the United States Congress on, we're having trouble getting generic medications. And it's not because of the distribution network. It's because, frankly, the consolidation that's gone on in the generic industry, some of the health and safety standards, some of the people that are doing these things. And that's a whole different subject. The idea that this is a big problem for generic distributions is absolutely, completely wrong. And most veterinarians, they don't deal with one distributor, they deal with multiple distributors. Matter of fact, if you can't get it through a distributor, we go to, most of the prednisone prescriptions are going to go through a pharmacy, for goodness sakes. But that's getting to be difficult to afford compared to the old days. Prednisone used to be very inexpensive medication, wide, broad spread effectiveness, one that you need to check on because chronic administration could cause serious problems. So even if it's a generic medication, doesn't mean that it doesn't need veterinary supervision. I think it's really important for the panel to understand, what's going on here. The basic issue we have here is who do you trust? Is this about trusting pet meds that's in this purely from a business standpoint to make money off of your pet? Or is this about trusting your veterinarian, which has the best interests of you and your pet in mind? And I'd urge the FTC to put a little bit of that heart into that business background that you're using as you go forward. And with that, I yield back, Mr. Chair.
Chair, thanks, gentleman. Gentleman yields back. Chair recognizes the gentleman from Oklahoma. Mr. Mullins, 5 minutes for your questions, please.
I'm not sure how you follow that up. I think you summed it up pretty well. I've also got a letter here